Hello, world, and welcome to the For Your Best Self podcast. It's Dr. Saluja, and today I'm excited to discuss our newest treatment, PDO Threads. I had the PDO thread procedure, specifically the BussoLyft, personally in early 2021, which led me to learn more and bring the procedure into our practice. I had a maintenance treatment in 2022. PDO stands for dioxanone, which is the material that PDO threads are made of. So polydioxanone is the material, and now you can just call it PDO. It's dissolvable, usually over 1 to 4 months, depending on the type of PDO threads. So what are the categories of PDO threads? There are 3 main categories. One is a lifting thread. That's the type of thread I use to reposition the fat pads of the cheek, the jowl fat pad, and to tighten, or as they say these days, snatch the jawline and upper neck area. These threads have tiny barbs or hooks on them that attach to the tissue within the fat pads to help lift them. After lifting threads, there's also volumizing threads. This type of thread is used to replenish volume in areas that are depleted of volume, such as facial hollows. 3 are collagen stimulation threads, and this thread stimulates collagen. And for example, I use this type of thread on the lips to help define the border and for lip anti-aging, or in someone who may be reluctant to get fillers. Under-eye crepiness or neck crepiness is another area I use collagen stimulating threads. And finally, forehead lines. We can diminish forehead lines over time with collagen stimulating threads, especially if we want to use less Botox on the forehead because of risk of the eyebrow dropping. So threads can be used on the face or on the body, and today I'm going to focus on the face and neck for this conversation because I'm going to specifically talk about the BussoLyft shortly. So threads stimulate collagen regardless of the type, and typical results are immediate, and then they also improve over weeks. Smaller stimulating threads may be done more often, and lifting threads may be done every 9 to 12, maybe 9 to 15 months on average. And you can alternate them with dermal filler or alternate them with other procedures such as radiofrequency microneedling or laser or ultrasound or broadband light. And it's where the synergy of these different treatment modalities is just better for an all-around anti-aging or restorative or rejuvenative effect. Speaking about the different treatment options, a patient may choose threads over filler or Botox or device because of different reasons. Some of these reasons may include really that no more volume is needed and more lifting is needed. We don't want to over-volumize the face. And so after volume is optimized, we want to lift. So we use threads in this case. On the nose threads may pose less risk than filler when you're doing a liquid rhinoplasty. Botox works on muscle, and devices often focus on the skin, and it might be time to look at the fat layer that's fallen, and threads specifically work on the fat layer. The lifting threads specifically work on the fat layer. And then patients may not be ready for surgery, such as a facelift or neck lift, and are working through a customized, minimally invasive or non-surgical plan that includes threads. The good news is that the treatments complement each other. So, for example, a customized plan might include Sculptra and filler to support the bony scaffolding and to help with recontouring and revolumizing, laser resurfacing or microneedling or broadband light to diminish the discoloration, the precancers, and the fine lines from sun damage, Botox to relax the muscles that pull down on the brows or the mouth, and then, of course, our PDO threads that may help with repositioning the fat pads or lifting the fat pads of the face or jawline that have fallen. And then, of course, they also stimulate the collagen in areas of crepiness or that, or I'm using them in areas that need more definition. So I specialize specifically in the BussoLyft PDO thread treatment that I learned and refined with Dr. Busso. It's a unique procedure designed to reposition the fat pads of the skin that have been brought down by age or gravity. It really improves the lateral area underneath the eyes, the cheeks, and the jowls. PDO threads can be combined with other treatments, as we've talked about, for best results. And of course, maintenance is recommended. So for the BussoLyft PDO thread treatment procedure, expect to be in the office 1 hour prior to the procedure. At this time, we do the consenting, the photographs, evaluating and marking the face with a pen or skin marker to draw out the vectors we're going to use for lifting the cheek or the jawline. Numbing the thread tracks or numbing these vectors with lidocaine so you don't feel any pain. It's actually a painless procedure pressure. Pressure is what you feel, and you feel the thread hooking and lifting. And treatment is really, really much more comfortable than patients are expecting, especially once they're numbed. The treatment is 30 minutes. Then you'll review instructions again. And then after the treatment, you may notice bruising, swelling, tenderness that may take 1 to 2 weeks to resolve. Generally, recovery is mild, although there may be a sensation that you're healing from the procedure during this time. I want to talk to you a little bit about the BussoLyft specifically. And the BussoLyft, in summary, specifically is a technique that's a closed facial lifting technique. The threads are inserted and they're passed under the skin surface. They're pulled to lift the descended or dropped tissue, and they're anchored at a point of entry, often near the hairline. This BussoLyft technique uses a reverse vector, and that helps reshape the face, the jawline, and it helps recontour. Usually I'm placing 3 vectors to lift, and each of those on each side. So 6 vectors total, 3 vectors on each side. I'm putting in 2 threads per vector, so 12 threads total. The threads create some volume, and they help lift. Again, they help lift those orbital fat pads, the nasolabial area where the cheek gets heavy around the fold, and then the jowl. And it also helps build collagen in this new position, which is key to the results lasting longer as the threads dissolve. Because remember, these are not permanent threads. The threads dissolve, which is why the procedure is safer than thread lifts years ago. So the results last because your body is building this collagen in the new position. And of course, with any anti-aging treatment, some maintenance is always required. So I know you want to do the BussoLyft PDO thread lift. And so I want to talk to you about pre-procedure instructions. You're going to be asked to stop taking blood thinners, so you do so a week prior to treatment, and that includes anti-inflammatory medications, blood thinners and supplements such as aspirin, Motrin, ibuprofen, Aleve, Advil, ginkgo, turmeric, garlic, flaxseed, any of these antioxidants. You're just going to stop, even fish oil, stop a week prior. If pain medication's needed, you use Tylenol instead. If you have a history of cold sores, please let us know or your provider know, because it might be advisable to take an antiviral medication prior to treatment. If you suffer from allergies or sinusitis, make sure your symptoms are under control before treatment. Also, let us know if you have an autoimmune disease or a suppressed immune system, because threads may not be right for you. It's recommended to discontinue tretinoin, retinols, exfoliants 2 days before treatment to avoid increased redness or irritation. And we ask that you not wear makeup or skincare products the day of your appointment. So now you've had the procedure. You're loving what you're seeing in the mirror. You can see it immediately after. What are your post-procedure instructions? Post-procedure instructions involve using cool packs if you need to reduce swelling, sleeping on your back for the first few nights, keeping your head elevated with pillows or using a recliner, taking Tylenol, or now you can take Advil or Motrin or Aleve as needed for pain control. You don't want to have extreme facial expressions for the first 1 to 2 weeks. It's normal, like I said, to have some tenderness or more of a sensation that the thread is there, and that can be accentuated by gestures or by extreme facial expressions, and that's why we ask you to minimize as possible. If threads are placed in the jowl, you don't want to open the mouth too wide for the first weeks. And, nothing serious happens, but the threads do shift a little bit as they're settling into place and your body's forming a reaction around them, and we want to optimize the lift as much as possible. Again, if the threads were placed in the cheek, which usually we do jowls in cheek, we want to avoid also motions where your mouth's too wide, maybe skip the comedy show that week. So we also want to apply your skin products. You're going to resume those a day after the treatment in a tapping or an upward motion. Application of antibiotic ointment and a Band-Aid is going to be put on the entry points after your procedure, and you're going to leave those Band-Aids on for the first 24 hours and then remove them, then start your skincare. If you have excessive bruising, please let us know, because it should be mild and it sometimes can appear a few days later, and that's okay, and it should resolve within the week. You really want to avoid high impact exercising and heavy weightlifting for 7 days. This is a great time to, do light work, read, watch some TV, or catch up on anything else that's not too strenuous. And then you're going to avoid facial or facial massage for 10 days. The last thing I want you to hold on is anything that requires any anti-aging that is heat related. So radio frequency, focused ultrasound, lasers, you're going to hold that on the treated area for 10 weeks. And that's about it. And that's what makes the BussoLyft and PDO Threads a great minimally invasive treatment, because it bridges the gap where you've had filler or you've had Botox, you're doing your skincare, you're doing procedures for the skin of this face, and you're still feeling like your face is heavy, right? It's the dreaded inverted triangle or the square face that we're trying to get more triangular. We call it the triangle of youth. We want the jawline to feel more defined or look more defined. You can also do this very early, very popular in the 30s, to keep your skin behaving in a younger manner. So so this is our introductory information on PDO Threads and BussoLyft. I hope it was helpful. And if you wish to learn more and see some of our photos, visit our PDO Thread page at www.foryourbestself.com, or our YouTube videos or Instagram at Dr. Saluja, Dr. Novo, or call us. It's been a pleasure. And until next time.